Sanjit, I'm in a meeting.
Hello friends, this is Padma Mishra, Board of Director of IANT, and I would like to welcome and thank you all our viewers to join our this live webinar. And the topic of webinar is mental health and for all, no more stigma, no more shame. Before we proceed about our webinar, our topic, I would like to tell you about some IANT. So, the India Association of North Texas is non-profit, non-political, non-sectarian organization established in 1692 and incorporated in 1976. IANT's vision has been to serve our Indian community. For the past 59 years, we have increased the footprint of people of Indian origin through various community programs across discipline. Be a part of our journey, collectively make a difference. So I would like to read some our disclaimer for this webinar. Please bear with me. So by attending this webinar, you agree to be recorded and
this meeting is being recorded.
Recording in progress not to hold liable any organization or panelist participating in the webinar. The purpose of this webinar is spreading awareness of mental health disorder. Its effect on children and adults, and treatments are available. Its content is not to be constituted as a personal advice. Information provided here is generic. So specific issues, please consult your specific school of admission. Information shared here may have been collected for different sources. This doesn't have supersede any medical advice from our own health service provider. So let's proceed about our webinar. And today's topic is mental health for all. No more stigma, no more shame. To continue this webinar, I would like to introduce our IANT elected president, Mr. Urmit Juneja. He's very nice person, good person and Urmit Juneja is an entrepreneur, technology leader. He has been with IANT for a couple of years and has been serving the DFW community for last decades. He joined IANT board in 2019, was a joint secretary in 2020, and now he is president-elect. He is also a board of Ek Noor Gurudwara in Frisco. Urmit lives in Frisco with his beautiful wife and two adorable kids. I would like to welcome to Urmitji. Urmitji, please join this meeting.
Thank you, Padma ji, and welcome to all the viewers of DFW. As Padma ji informed, India Association of North Texas is the premier and the oldest community organization serving the Indian community in Dallas and Fort Worth area of North Texas. It is also an umbrella organization for all the other community organizations of various Indian origin and Indian states. This is a part of, so today's webinar is part of the series of webinar that we started last year when pandemic hit, and we were wondering how we can contribute to the community. This year we've had around 5 other webinars starting in January, and last month was May, which was the mental health awareness month. So we decided that nothing can be better than holding a webinar on mental health awareness. Before we move further and start with the details of this webinar, I would like to thank all our members of the board, without whose contribution these webinars are not possible. We all dedicate as a volunteer a lot of our time to make happen such webinars and all other community activities that IANT does. Recently, IANT held a vaccine camp for the DFW community, and we administered over 500 doses of vaccines by partnering with the local pharmacy. We are also a partner to the Consulate Journal in Houston and the Council in Houston, where we bring in various services that the consulate offers. And very soon we'll also be resuming the visa camps. We are already discussing with the consulate, and as they are ready, we will be informing you. We also urge all of you to visit our website regularly, www.iant.org. I would also like to thank our trustees, whose guidance is paramount when we hold such activities for the community. Also, our sponsors who are behind us all the time, the entire year, and contribute financially and through guidance to India Association of North Texas. Without them, again, it won't have been possible for us to organize various events and function as a non-profit organization. Our streaming partner, Mahamaza, which is again, part of our webinars, thanks to them, their team is always available to help us. Again, everybody is a volunteer, so they also spend this community time. Our Vice President, Mahinder Rao, who is always there to guide us during all these webinars and is the backbone of our IT platform. So thank you to all of you. And I'd like to introduce now our moderator. She is a banker with more than 35 years of experience, Shushma Malhotra. She has been on the board of IANT for last 2 years, and this year she's serving as a secretary of IANT. Apart from IANT, she is part of various other organizations. She is on the board of Chetna. Chetna helps the victims of domestic violence in local South Asian community. She's a member of the executive board of Asian Chamber of Texas and chairperson of the Mead Center. She currently serves as the president of Dallas Women's Lions Club and is a chartered member since 2005. In her spare time, she loves to do gardening, cooking, and traveling. So I would like to turn over the forum to Shushma ji, and again, welcome you all and welcome all the panelists. And she's going to introduce all the panelists to you. And please enjoy and be with us. And, we love bringing you all these webinars. Over to you, Shushma ji. Thank you so much.
Thank you so much, Urmeet. Good afternoon, everyone, and welcome to the webinar on mental health for all. Before we proceed, I would just like to thank the IANT Board of Trustees for their support, President of the IANT Board 2021, Mr. Shailesh Shah, for giving me this opportunity, and thank you to President-elect Urmeet Juneja, Vice President Mahinder Rao, Dinesh Huda, Chandrika Shettikar, Nawaz Shah, Srujan Khonga, Padma Mishra, and of course the entire IANT Board that has made this possible. And also big thanks to Mamaza for all the work being done behind the scenes. So let's get started. The last year and a half, while navigating a global pandemic has undoubtedly been very challenging for all of us. Many of us have been stressed financially, emotionally, physically, and the isolation and distance from our loved ones and friends has taken a toll on us. Even prior to the pandemic, the mental health of South Asians was suffering. According to the Asian and Pacific Islander American Health Forum, South Asian Americans, especially those between the ages of 15 and 24, were more likely to exhibit depressive symptoms. Another report found there was a higher rate of suicide among young South Asian American women compared to the general US population. Unfortunately, according to the same report, South Asian Americans had the lowest rate of utilization of mental health services. This is a conclusion that should come as no surprise to anyone who has been raised in our community. Our community has struggled for so many years to overcome the stigma and social discomfort around mental illness, even though over 5,000 persons of South Asian origin practice psychiatry in the US. However, the new generation of South Asians is becoming increasingly more aware about the mental health struggles, and they are seeking treatment. But this isn't easy for them too because of generational and cultural differences within their own family and friends and peers. We just celebrated the Mental Health Awareness Month in May. However, eradicating the shame and stigma surrounding mental illness in our community requires a concerted and ongoing effort year-round. With this goal in mind, our webinar today brings together 3 mental health professionals from our community to share their experience and knowledge with us. The attendees will have the opportunity to ask them questions on YouTube, where this video is being live streamed. Okay, it is now my pleasure to introduce our esteemed panelists. Dr. Jyotsna Neni is a board certified general child and adolescent psychiatrist. She completed her general psychiatry residency at New York Medical College and child psychiatry fellowship at University of Texas Medical Branch, Galveston, where she served as the chief resident. She has worked in a variety of clinical settings in the Metroplex area. At this time, she is in private practice in North Dallas, where she treats children and adolescents who are experiencing mental health issues. Dr. Rachita Sharma is currently the chair of the Department of Rehabilitation and Health Services at the University of North Texas. She is also the clinical director of the IANT Well Clinic, where she supervises the clinical training of graduate and undergraduate rehabilitation studies. Dr. Sharma is a licensed professional counselor supervisor in the state of Texas and a certified rehabilitation counselor. Aside from her regular research and professional service commitments, Dr. Sharma conducts numerous presentations annually in conferences around the nation, focusing primarily on ethics, cultural competence, and social media. Mr. Nirav Shah is a licensed professional counselor at Zen Counseling in Carrollton, Texas, and has been practicing since 2017. He primarily works with clients aged 14 and up, and specializes in working with depression, anxiety, self-esteem, and other mental disorders. Nirav's focus as a counselor is on creating a safe, non-judgmental space in which clients can grow. He is committed to his work as a counselor and is passionate about educating the public on mental health. So welcome to all 3 of you. We know that 1 in 5 Americans will be affected by a mental illness at some point in their life. Dr. Sharma, can you shed some light on the statistics on mental health for Indians and South Asians?
Absolutely, Sushmaji. I'd be happy to do that. I actually have some slides that I would like to share to present this information. So I'm going to share my screen and share with you some of the statistics that I and my colleague, Dr. Contractor, have uncovered in our research when looking at mental health in the South Asian community. So what we find is that when we look at mental health in general in the South Asian community, there is very limited information and research in our field looking specifically at the mental health of South Asians. What we find is that about 2.81% of Asians, that includes Asian Indians, have a lifetime prevalence of disorders such as anxiety, maybe some depressive symptoms, or perhaps some substance use that might include alcohol or other drugs. However, what tends to happen is there's an immigrant paradox. There's a belief that immigrants that come into the US from other countries, including India and other countries in South Asia, do not experience as much psychological distress as might be expected. However, because of this, not a lot of research has been done in this area. What we're finding is the immigrant paradox is actually incorrect. Even though a lot of immigrants, including Indian immigrants to the US, may initially not feel as much psychological distress as would be expected, over time, though, the mental health of such immigrants tends to deteriorate, and it reflects the mental health outcomes of the general population. So in other words, even though initially during the immigration process, there might be a lot of resilience, that does tend to then deteriorate and mental health symptoms begin to emerge in the Indian or Indian American population. Despite that, though, there is less utilization of mental health resources, and people tend to drop out earlier if they do go in for counseling or therapy among the Asian Indian population. A lot of studies, like you mentioned earlier, Sushmaji, have found that there's a very high susceptibility among South Asian immigrant females to self-harm, and they tend to display higher rates of mental disorders such as depression, anxiety, insomnia, and even eating disorders or disordered eating pathology. Overall, though, what we're finding is that studies are demonstrating Indian immigrants are experiencing very high rates of mental health disorders, which oftentimes are going unaddressed. There also tends to be a cultural impact on how symptoms are presented. So instead of mental health symptoms, a lot of times they're somatized or they're psychosomatic symptoms, meaning that they may say, I'm experiencing muscle aches or a headache that won't go away, or my stomach is upset, instead of saying that I'm feeling depressed or sad or anxious. So what happens is in the Indian population, and especially in South Asia, especially in the Dallas-Fort Worth area, we have anywhere from a 0.8 to a 10% population of Indians living in areas between Fort Worth and Dallas. Irving tends to have the highest population of Indian individuals living there. There are a lot of barriers in help-seeking behaviors. Some of it comes from stigma, as was mentioned earlier. Some of it comes from just the way that symptoms are expressed in our community. And then some of it comes from the level of acculturation. How comfortable is the individual with the dominant American culture versus how closely are they affiliating with the Indian culture, which they're most familiar with. So my colleague, Dr. Contractor, and I did some research about this about 2 or 3 years ago, and we looked specifically at 300 individuals who answered our survey here in the Dallas-Fort Worth area. And we asked them questions about mental health. So what's in front of you on right now is one of the questions that we'd asked our participants about who they would talk to if they had a mental health problem. And what we found was that more than half of the individuals who took the survey said that they would rather talk to a friend or a family member if they had a mental health concern as opposed to talking to a mental health professional. Some individuals did agree that they would like to meet with a therapist or a social worker or a psychologist, but that tended to be less of a preference than it is to talk to people that they're familiar with, such as friends or family members. We also asked our participants if they would prefer a therapist or counselor that was of the same ethnic or racial background. And while half of the individuals roughly said they didn't really care so much for that, they didn't have a preference either way, we did find that about 30% of our participants said that they prefer to work with a South Asian therapist if they did go in for mental health counseling. We asked our participants if they would prefer a therapist who speaks the same language, because we know a lot of times the language that we use helps us better describe what our symptoms are. So a person whose native language is any of the Indian languages may have a harder time describing their symptoms in English. And we found that almost half of the individuals said they would prefer if their therapist spoke the same language as them. And then this right here in front of us is kind of the larger question there. We asked individuals, even though we're not sure what causes mental health problems, what do you think might be the cause? And we found that a large majority of people believe that it was the experience of a stressful situation, or maybe the loss of a loved one, or financial issues that caused mental health problems. Then there was a second group of individuals who felt that mental health problems stemmed from political stress or maybe safety issues that a person was experiencing. There were a group of individuals who also believed that mental health issues stemmed from either some sort of infectious diseases, nutritional deficiency, or possibly a chemical imbalance in the person. And then some people, and this is kind of pretty important to keep in mind because of the cultural relevance of this, they felt that mental health disorders came from a disturbance of balance between mind, body, and spirit, that maybe it was supernatural, or possibly, and this comes from religious beliefs in Hinduism, Hinduism, that it might be something that they did in their previous life that is impacting the quality of their life right now. A relatively small percentage of people only believe that it came from a genetic imbalance. So to answer your initial question about what might be some barriers to seeking mental health services in the Dallas-Fort Worth area, within these 350 individuals that we interviewed and did research with, it fell into 5 categories. One was a belief that there was this normalization of symptoms. People believe that sadness is pretty typical, or that as you get older, people tend to get depressed, or that it's normal for a person to feel the way they do, to feel sad, given the life circumstances that they have. So this normalization of symptoms kept them from seeking support. There was also a lack of know-how. People said, I just don't know how to look for a therapist. I don't know what to even begin, where to begin. We also found that people sometimes misunderstood the need. They felt that you only go to a therapist or a counselor if there's something seriously wrong with you. They said only crazy people go to therapists, not people who are just feeling a little sad or a little upset or a little anxious. There also tends to be an extreme reliance within our community based on this data of self-reliance, feeling like I've done this before, I can do this again, I need to figure this out myself. I don't need anyone else to show me how. And then lastly, a big majority of the population that answered our question in the community felt that it was cost prohibitive to attend counseling. It was expensive, they didn't want to keep paying for sessions, and that was a barrier to them. So despite these barriers, though, I do want to say we did find some positive indicators that came through our research, and this was that almost half of the individuals that we interviewed did agree that they would seek a mental health professional if they had a mental health problem. So this is indicative of some reduction in stigma that is happening in our community. So as we were very glad to see this, and it's events like this that provide education to attendees that really allow them to work through what the concerns they might have about reaching out for mental health care.
Oh, yeah. Thank you, Dr. Sharma. That was really good information. I mean, this information is really enlightening. And like what you said, that people don't really recognize this. So let us, I want to ask you that when we are letting everybody know about this, what are the differences between a therapist, a counselor, a psychologist, a psychiatrist? How does one know which one they need?
Yeah, that's a great question, Sushma. I'm so glad you asked that. A lot of times these terms are used interchangeably. People may say therapist or counselor or psychologist. However, there are some specific differences between them. A lot of it depends on the training the individual has. A psychiatrist is actually a medical doctor. They have gone to medical school, then they've received between 2 to 3 years of very specialized training in learning how to manage and diagnose mental health disorders. So if an individual is interested in getting some medication involved to help them with their mood-related symptoms, then a psychiatrist is a great person to start with. Psychologists, on the other hand, are individuals who have a PhD in psychology or counseling or something that's trained them for 5 to 6 years on learning how to provide a lot of therapy to them, long-term therapy to help them learn better ways of managing their symptoms and managing just their life as they move forward with certain mental health disorders. Counselors typically have a master's level education in counseling and also have a state license to practice counseling. So typically you might see the acronym LPC, Licensed Professional Counselors. These are individuals who've completed their master's and then after that done 3,000 hours of supervised work to get a lot of training in helping individuals learn more about their mental health disorders, to manage the symptoms and things like that. So if an individual is interested more in talk therapy, but not medication, then they might want to begin either with a counselor or a psychologist who's at the doctorate level. Therapists, the term therapist can sometimes be used for all three individuals. If they're getting therapy from either a psychiatrist or a psychologist or a counselor, that term could be used for that. Therapy tends to be a little bit more long-term. Counseling tends to be a little bit more short-term. So it might be maybe 6 to 8 sessions as opposed to therapy, which individuals might engage in for much longer periods of time.
Mm-hmm. Oh, thank you, Dr. Sharma. The last year has challenged us in so many ways. As social beings, the loss of our routines and daily structure has been unsettling. While we were juggling the demands of working from home, childcare, homeschooling, and also taking care of our elderly parents. So some of us who are frontline essential workers did not have the choice to work from home, like I didn't, and they had to be at work in person and risking getting infected, and they were worried that they would get their loved ones infected too in that. So at this time, our usual coping skills no longer seem to be working, and many of us feel like we've been running on empty. So with that being said, Nirav, how can one distinguish the ongoing stress from the pandemic from mental illness?
That's a good question. Thank you. Really, a big thing that we look at with mental illness or daily life stressors, right, is the severity of how long the symptoms are going on. A lot of natural things like grief, loss of a job, other situations like that will bring on depressive symptoms, but they may subside after a while once things potentially get better or we learn other coping skills. I always recommend people, if they're comfortable, coming to someone to talk to, like such as a therapist, and, just letting it all out kind of and seeing where it goes from there. And then if the symptoms continue to persist, I think definitely getting the advice of a medical doctor, such as a psychiatrist, is important at that time.
Okay. So I want to ask you now, what are anxiety disorders and why do some people have panic attacks?
Okay. So an anxiety disorder is a mental health disorder that's characterized by feelings of worry, panic, fear, or anxiety in general, which is what it's called. The examples are panic disorder, OCD, PTSD, general anxiety disorder. So there's actually two things. There's a panic attack and there's an anxiety attack. So panic attacks really actually happen out of the blue, and we don't necessarily know sometimes what the trigger is. An anxiety attack is a specific response to a specific trigger. Like, for example, let's say I'm afraid to go out into big crowds. So then I may get an anxiety attack when I have to go speak in front of a crowd or go out to a sporting event or a party or something like that.
Mm-hmm. Right. Yeah. Okay. So what are mood disorders?
So mood disorders are things that involve disturbances in our emotions. So there can be periods of excessive sadness, which is depression, or excessive elation or joyness, which is mania. So depression and mania are kind of like the two polar opposites of the opposite end of the pole. So mood disorders are really going to affect those types of things.
Okay. So thank you, Nirav. So talking about depression, we have been hearing a lot about depression in the news lately. I mean, it has been there in the news many times before, but recently the world famous tennis player Naomi Osaka was in the news because she declined to speak to the press, citing mental health reasons. We also know of several celebrities who have spoken up about their struggles with depression from time to time. Dr. Mutineni, what is depression and how is it treated? You're on mute. Dr. Mutineni, you're on mute.
Sorry. So depression is when a person is sad for a great period of time. Clinically, we say if a person has been depressed consistently for more than 2 weeks, they're considered as experiencing major depression. It's not just feeling sad, not finding joy in anything in life, something which gave you joy before. For instance, if gardening was your passion or, something that cheered you up, now it doesn't give you fun. Or if you played cricket to make yourself feel better and you're no longer finding joy in it, then that's something that is concerning. That is what we call anhedonia, not finding joy in anything. Change in sleep and appetite. Some people cannot sleep when they're depressed. Some people tend to sleep a lot and still they don't feel rested. Change in your appetite. Some depressed individuals eat and they gain weight, and some depressed individuals lose weight. Change in concentration, they struggle to concentrate, so their ability to perform at work or at school changes. low self-esteem, where they don't feel good about themselves. And then in that process, they try to do things to make themselves feel better. And having suicidal thoughts, that is more severe, but suicidal thoughts of not wanting to live, feeling like a burden on others, increased sensitivity. These are all symptoms of major depression. So when Naomi Osaka said she had mental health issues, she was also talking about anxiety and the immense amount of anxiety she experiences when she has to talk to all those journalists. And she's this young woman in front of all these journalists after a big match. So she was experiencing that anxiety, and she didn't want to put herself in that position. So that's when she said, I want to focus on my game, not become worried how I'm going to face these journalists. And that's when she decided not to participate in the post-match conferences. Now, treatment for depression is medications, psychotherapy, which is counseling or seeing a counselor or a psychologist, and some lifestyle changes. A combination of medication and therapy helps immensely in improving symptoms.
Mm-hmm. Thank you, Dr. Muthuneni. Can you tell us a little bit about bipolar disorder and schizophrenia?
Yeah. So bipolar disorder is where a person experiences both depression and mania. So when a person is depressed, person is having low energy levels, not functioning well, whereas in mania, they have extremely high energy levels, where they have to be on the go. They're moving all the time. They sleep maybe 2 or 3 hours and then they can function. Their mind is racing, so what they talk doesn't make sense. They can be irritable, and they can be impulsive. So if the person is someone who's very conservative with their money, they will go on a shopping spree, do things that are not that person. It is a big change in their personality. And so this is the opposite end of depression. So some people have experience both the symptoms. So they'll be depressed for a few days, and then they'll have manic symptoms. Then they could be at their baseline, in a sense, be functional. And then after a few weeks or months, again, they could have either symptoms of depression or mania, and this tends to go in cycles. And schizophrenia is where people can be very paranoid for no reason, like someone is following them, or they hear voices or see things that others cannot see, and their thoughts are very disorganized, and they will not be able to function in the society. So that's how there's a lot of psychotic symptoms where everything is not real. Their reality testing is poor. Those are the symptoms of schizophrenia.
Okay, so Dr. Muthuneni, are depression, bipolar disorder, schizophrenia, and other mental illnesses hereditary?
Yes, a good number of them are hereditary. Our genes play a big role in what we have. If our family member had depression, doesn't mean that the next generation may have depression. It may manifest in terms of anxiety. Someone else may have bipolar disorder or schizophrenia. The best way to, and the thing is, in our community, we don't know what our ancestors had, because it's not something we speak of quite openly. And we don't, very few might have sought treatment. So if someone asks, we would say most likely, we don't have any family history of it. But there could be a family history of mental health issues which we may not be aware of. we may say, oh, our aunt is always sad, or she's very lazy, or he's very lazy, and they may be really depressed, or, or if they're all over the place, oh, he cannot function well, or she cannot function well, whereas there could be an underlying mental health issue.
Yeah. That is very true, yeah, because in our culture, we usually do not talk about this, and lots of people don't even know about this. So especially our elders, no one would ever question the elders to find out if they ever had any mental health issue.
Yeah. And a lot of anxious people, it comes out as irritability. So people will say he or she has anger issues. Whereas, or the family members will say, oh, he's an anxious person, he can be irritable, but it has never been addressed by a professional. So for us, that doesn't come as a family history of having anxiety or any mental health issue.
Yeah, that is true. So in that case, I think a lot of the study also is very challenging, because we don't really can tell whether someone has a history or not.
Yeah.
So, Dr. Sharma, I want to ask you, is it important to go for talk therapy if one is taking medications for depression, anxiety, or any other mental health conditions?
Yes, I would say yes, absolutely. Medication can be extremely helpful in helping a person manage the symptoms. So if they're feeling so impacted by their mental health disorder that it's impacting their quality of life, their work satisfaction, the joy they feel, it's important for that person to get medication. However, when we look at research, what we find is that if people only take medication for mental health disorders, what they find, maybe about 40% of them or 50% of them might experience long-term benefit from it. Similarly, if you only go for talk therapy, again, about 40 to 50% might experience a lot of benefit from that. But it's when you put the two together, it's this combined approach of medication and talk therapy. A lot of patients report, I'd say between 60 to 70% of them report experiencing maximum benefit, because not only are they now addressing the genetic component of it, that imbalance, so to speak, chemically, but they're also learning newer patterns, newer ways of behavior, newer ways of thinking that then leads to a lot of long-term growth and management of their symptoms.
Yeah, sure. And how can one navigate the social stigma of seeking mental health within the Indian American community? I mean, as we all know, that this is something very challenging. All of us, we find that, right, in our daily life, whenever we talk to anyone. So what can one do?
It is. Well, you heard me say earlier how in our society, in our community, there tends to be a normalization of mental health symptoms, so that people think it's okay for me to feel this way. I don't need help. What we need is kind of the opposite. We need a normalization of help-seeking behaviors for a person to say, I'm not feeling my best mentally. It's okay for me to go see a therapist or a counselor. People tend to think you have to be, as is often said in Hindi, pagal or crazy to go see a therapist or a counselor. And what we need is for people to understand you don't have to have severe symptoms in order to go see a therapist or a counselor. Just like if we physically don't feel well, we'll call a doctor, we'll make an appointment, and we'll go see them. We can do the same thing with our mental health as well. It's okay for an individual to go work with a counselor, even if they don't have a diagnosed mental health disorder. They do it just to increase their overall quality of life. And I think we as a community need to support that. So if somebody tells us, I'm seeing a therapist, instead of saying, why? What's wrong with you? Why do you need to see a therapist? We need to say, well, that's great. It sounds like you're working on something important in your life. And it should be okay. Just like we tell others that I have a dentist appointment or I have a doctor appointment, it should be okay for us to also talk about that. Oftentimes when I tell somebody, well, I've seen a therapist before when I was going through something that needed that extra support, people are surprised. They'll say, why? Why do you need to see a therapist if you're a counselor yourself? And I'll try to normalize that and say it's okay for all of us to seek that extra professional mental health support when needed in life. So that normalization goes a long way in our community.
Mm-hmm. So we are talking about the people who suffer from mental illness. What is the impact of mental illness on their family members and caregivers? We usually don't talk about that.
They often don't. You're right. And like Dr. Mitanani was saying earlier, a lot of times in Indian South Asian families, there are a lot of undiagnosed mental health disorders. So a person, an aunt or an uncle or your mom might have displayed a lot of symptoms of things like depression or anxiety, but they never went in and got diagnosed, did not get the support they needed. So how that impacts us is that we, when we're children, we learn a lot of our behaviors, the way that we think, the way that we do, the way we make sense of the world, which is called our schemas. Those things are impacted by the way that we're raised. So if you're raised by a parent or another family member who has a lot of these anxiety or depression symptoms, children tend to also start learning those sorts of behaviors sometimes. They may not learn the right coping mechanisms, the coping skills that allow us to soothe ourselves when we're feeling anxious or feeling depressed. And so when we then become adults, we tend to carry those behaviors with us into adulthood. So this can certainly impact a lot of the children growing up in such households, but it also impacts the overall quality of life of people. Even if you're an adult and you grew up in a household where there was no mental health concerns, but maybe you're encountering some extreme stress in your own life and you're not getting that support, that's going to mean that you'll continue experiencing diminished interest in your life, like Dr. Mitanani was saying earlier, anhedonia, where you just don't find joy in doing the things that you previously used to enjoy. And so overall, then it just starts impacting all areas of our functioning, whether it's our relationships, our friendships, our work life, and our overall, just the satisfaction that we get from being an individual from day to day.
Yeah, thank you. Thank you, Dr. Sharma. Nirav, we have learned that seeking therapy can be challenging for many people. It always brings so many questions. It's not just mental health therapy, but it is also even otherwise, like if we are not feeling well. So it brings up so many questions and insecurities. Some of the questions that come up for people as they consider this kind of mental health help for their children or for themselves are, I'll just read and then you can let us know. I do not know what to say or talk about to my therapist during our first session. Is that normal?
Yeah, it's completely normal. A big thing I do in my first session with people is I ask them, have they been to counseling before? Yes, no. A lot of the time, no. So what I do is I ease them into it. I start off with saying, tell me a little bit about yourself. And then as we continue that conversation, get it going, I then ask them, what brings you in? And then if you have any goals, would you like to tell me those goals at this time? And I also tell them it's okay if you have no idea what to talk about or if you don't have any goals or anything like that. It's a first session. It's a get to know you session. It's kind of establishing a lot of that rapport too, and getting for the client to get to know the therapist and the therapist to get to know the client, and then to continue to build that strong foundation, which then after a while, once they're comfortable, they're more likely to open up. But no, there's no right or wrong thing to say in your first session.
Yeah, that's a great way of making people comfortable with their therapist. So what exactly is confidential in the therapy sessions? Will my therapist judge me for the things I disclose in the therapy?
So the limits to confidentiality really are if you disclose that you're a harm to yourself or others, or if you disclose the neglect or abuse of a child or elderly person. That in Texas, we do have a duty to report. And so those are the only times I would report something. Most of the time it's something confidential. I'm not going to say anything. And there's no judgment. It's a safe space. That's the whole point of this, is creating a safe, non-judgmental space where people can express their feelings, their thoughts on what's going on.
Yeah, that's good to know. What if I do not connect well with my therapist? What can I do at my end as a client to maximize the benefits of therapy?
Mm-hmm. Just like with a job interview, if you call a few therapists, you can ask them a little bit more about what techniques they use, kind of what their style is. If you feel like you don't connect with your therapist, it's okay to tell them that, hey, I don't feel a connection. There's nothing wrong with that. Our feelings will not be hurt. What we want is the best for you. So we can find you referrals then. It's honestly, if you don't feel like you connect, that's okay. You can find a different therapist. Most people are afraid to because they think they'll hurt the therapist's feelings, but as therapists, we completely understand.
And I know this is something a lot of people would like to know. Will my employer know that I'm seeking mental health therapy, especially if I'm going through my employer's employee assistance program? And what if I'm using insurance paid for by my employer?
Okay. So if the EAP, let's say, is mandated by your employer, they may ask for some progress notes or updates. Like, let's say you have anger issues or something like that, and you're being forced to go to counseling through that, and the employer is using the EAP to have you do that. Then the therapist, they may ask for, like I said, progress notes. How's the client doing? How's the employee doing? If you seek EAP on your own, then again, the only limits to confidentiality that I said before, your employer cannot know what else is said in those sessions. Okay. And if you're going to use insurance, again, that's between, yes, you can have insurance through your employer, but the insurance still, that's between you and the insurance company. And usually they're not going to request any notes or anything like that. So there's a limit to confidentiality there too.
Okay, that is good to know. Thank you, Nirav. So let us pivot here and talk about the mental health issues in children. Dr. Muthineni, what are some of the most common psychiatric conditions in children? What should one do if their child needs mental health help?
The most common mental health issues in children are ADHD and mood disorder issues, and which you see from elementary age to high school. You may see autism spectrum disorder in children who are younger than elementary school, and usually the pediatrician picks up on the symptoms of autism spectrum where they're not able to connect to the family, where they're not able to relate to the parent, where the child cannot relate, does not have the usual emotional responses. That's autism spectrum, and pediatrician picks up the symptoms because they do screening regularly, and they are referred for treatment. But from elementary school on, we see mostly ADHD, attention deficit hyperactivity disorder, and depression and some anxiety disorders. With ADHD, it's mostly when children cannot pay attention, they're restless, they're not able to complete the schoolwork, they're all over the place, and they're smart. They're very intelligent kids, but they're not able to get their tasks done. They're not able to remember things. And in the community, what we think as he's not putting in enough effort, or he's just, usually in boys, it's like, oh, he's a boy, he'll grow out of it. Or, oh, he's being lazy, he's not doing the work, whereas it's like, they want to do the work, but their mind is running 100 miles an hour, whereas they have to run only 10 miles an hour to finish the work. So they can't pay attention, whereas they can play video games very well, because in ADHD, the video game, it runs at the rate their mind runs. So the parents attribute that as them wanting to play games, not be engaged in their school activities, especially academic activities. They will be doing well in sports and other activities. Then depression, we see more often we see in middle and high school children, and this and other mood issues we see quite often. About 10 in American society, about 1 in 10 children have some issues with mood, and even I'm assuming it would be the same in our community, where they're more irritable, in children, depression is usually manifested as irritability. So they are lashing out at people for no reason. They're very sensitive to anything you say. So the family would be walking on eggshells, but they may not realize that my kid is depressed. Sometimes the kid may be able to say that they're depressed. Then you see a change in their grades in school. It could be sometimes a change in friends they have, because a different set of friends may make them feel better than the current set of friends. Again, sleep issues can be seen a lot, where these kids tend to go to sleep very late. They're not doing what they are supposed to do, and a lot of defiance could be seen when they're also depressed. And a lot of teenagers are self-harm, where they're cutting or doing something to their body to hurt themselves. And a lot of kids have suicidal thoughts, and some have even a plan. And very few carry it on, but quite a few do that. Those are the things we see. In addition to that, we see in teenagers eating disorders. There's a cultural expectation of us. We expect them to look a certain way, but at the same time, we want our child to eat a big plate full of food. So we give them a big plate, but then if the child is not physically what is acceptable to our society, then again we chide them saying, okay, why are you like this? So bulimia tends to run in these kids, where they eat and then throw up, because bulimia is that where you eat and make yourself throw up, because that's how they're able to make their parents happy, because they ate all the food served to them. But then they throw up and are able to make sure that they're physically, again, acceptable to everyone. So those are some of the mental health issues we see in children.
Mm-hmm. Well, that's something, very amazing. When I was growing up, at least my age, I know we never knew what is ADHD. I mean, I learned it much later in my life that this is. So I think this is like a awakening for a lot of the parents that this can happen. These are the things that happen in children, and they need medical care at that time.
Yeah, especially with ADHD, when it's not treated, a lot of children have develop defiance. We call it oppositional defiant disorder, because ADHD kids cannot pay attention. They cannot remember things. So if you tell them to do a list of 5 things and they can only do 3, and then the parent gets on top of them saying, why don't you complete all this, or you don't do this? So I'm never good enough. So if the child feels that I'm not ever going to be good enough for my parent, they tend to lose interest in it. Then they tend to argue. They become that parent which they become the child which the parent will be like, what happened to my child? Mm-hmm. Always arguing, not following anything what they ask them to.
Mm-hmm. Yes, that is very tough for parents too, because parents are also not experienced, right? I mean, we don't come with experience of how to raise a child and how to understand all these mental conditions in a child. So it's tough. Neither the parents know that, and of course the child doesn't understand at all. And that's when we need the help of experts to take care of the child and also the parent. Dr. Mitaneni, are psychiatric medications good for children?
Yes, all the medications we prescribe are FDA approved. When I say FDA approved, that means they have done a lot of research studies in children and saw that they were okay. And but there are some side effects and adverse events associated with medicine. And whenever a child is prescribed medicine, the psychiatrist goes over the risks and benefits of taking the medicine, and what are the side effects you have to expect, or what are the worst things that could happen, just like every other medicine. And once the parent agrees, that's when we prescribe the medicine. But most of them are relatively safe.
So have you ever come across parents who choose not to give medications to their children? Has that ever happened?
Yes, there are some parents who choose first to send their child for therapy or talk therapy. So they want to try that route first. I say, well, let's try that. And if it doesn't work in a month or 2, then I want you to come back because based on your symptoms, I can say this may work to some extent. It will work a little bit. But you may need medicine. If the symptoms are very mild, like if you catch them early, like early stages of depression, maybe therapy could help and may not need medication. But if it's moderate to severe, then they will need medication and therapy, and the combination is extremely beneficial to the child.
Mm-hmm. So I want to ask Dr. Sharma, and then I'll ask Nirav also. When do you think that, like when you are, like Dr. Mutineni said about the disorders in children that they've seen, when do you think that now is the time to say that, okay, this child needs medical help, like psychiatric help?
Mm-hmm. Typically, I'm working with clients and they come in and they're a bit reluctant about taking medication. I'll work with them for at least a couple of sessions, and with the understanding that if after X number of sessions they're not feeling better, then we'll try to revisit the conversation of medication. So typically that happens when a person has been in talk therapy for maybe 4 to 6 sessions and they're still not feeling even the slightest bit better. So and it's impacting their quality of life. I work a lot with college students, so I find that the student is skipping classes. Their grades are falling. They're isolating themselves. They're not doing the things that we typically think college students engage in. So if their overall quality of life is not improving, even after 4 to 6 sessions of talk therapy or counseling, we'll start talking about possibly getting some medication involved and refer them to a psychiatrist, with the understanding that medication, like Dr. Mutineni was saying, sometimes takes a while to work. Sometimes they may experience some of the adverse effects first before they start experiencing the positive effects. So as a therapist, I want to be with them during that process and remind them of that conversation that the psychiatrist probably had with them, that you might experience some adverse effects, but it's important to continue taking this medication at least for a few months to let the positive effects come in and do what they need to do. And if it doesn't work after a couple of months, then to encourage them to revisit with their psychiatrist to see if there needs to be some change in the dosage of the medication, or maybe another medication needs to be prescribed to help them with their symptoms so that they can start doing the things that they want to do, such as, in that case, a lot of times going back to classes, feeling more engaged in their life, in their relationships, and just overall doing the things that they want to do.
Thank you, Dr. Sharma. So, Nirav, what has been your experience?
Similar to what Dr. Sharma was saying. So actually something that I ask a lot of my clients, adolescents or adults or whatever age range they are, I ask them when is the last time that they've had a physical exam and blood work done, because I want them to be able to rule out other things such as maybe thyroid disorder, which can mimic some mental health disorders. So I have a lot of them do that. And then from there on, we go through our sessions, we develop a plan, a goal, kind of see what their goals are, work through it. And kind of like what also Dr. Sharma was saying, if there's no improvement and things are not getting better, then that's when I bring up the conversation that, maybe it's time to look into a psychiatrist if you're comfortable looking into that. I also tell them, just because you go to a psychiatrist or talk with a psychiatrist doesn't mean that you have to take the medication, right? It just means that I tell them that they're the experts on that. So it's best to consult with them about that.
Mm-hmm. Yeah, that's good advice. Yeah, thank you.
Yes, or an adult doesn't want to take medication, I tell them, these are my recommendations. It's finally up to you what you want to do. But I give them, I help them understand how the medicine helps. And if the medicine, they choose not to take medication, then that is a choice they're making.
Mm-hmm. Yeah. True. Yeah. I also want to add something to that. What I find a lot of times in my experience with clients is that when they're coming in for therapy, many of them have been feeling, whether it's depressed or anxious, for a very long time. And know that things such as impact a person's overall mental abilities. So if a person is depressed and they have been for a very long time, they may have a harder time catching on to things, need a little bit more explanations on things. Or if they're so anxious, they may not always register the information that is being given to them. So I'll often mention to them that if they're coming in and they've been coming in for 4 to 6 sessions of counseling, not experiencing any benefit, it might be that their brain right now is just so full of anxiety anxiety or depression, that the things that we're talking about are not able to have the impact that we hope they will. However, once they start taking their medication, a lot of times you find is that these clients are then typically their brain, the anxiety or depression has been regulated enough that now they can start responding to a lot of the things that we're talking about in therapy, including ways to regulate their emotion or their behaviors or their perspectives. So like I was saying earlier, that combination is just very powerful for most people if they're looking for alleviation of mental health symptoms.
Mm. So, Dr. Sharma, I want to now ask something about adults. We talked about children, and we'll go back to that as well. But let's talk about adults now. How can one seek accommodations at workplace for mental health disorders without making it seem like one cannot do their job effectively?
This is a great question. I'm so glad you asked me that. What a lot of people don't realize, and this isn't just limited to our Indian community, but just the community as a whole, is that sometimes mental health disorders can be debilitating enough that they get classified as being a disability. So you can have a mental health disability, just like when we typically think of disabilities, we think of people that might have physical disabilities. Some people have mental health disabilities that impact their ability to engage in work at their job site the way they would want to. And if you have a qualified mental health disability, you are actually protected by the Americans with Disabilities Act of 1990. What that means is that your employer cannot discriminate based on your disability status. So if you have, say, severe depression, which you're getting treatment for, but sometimes you just have an extremely hard time getting out of bed, taking a shower, you just have no energy to even drive to work, let alone be at work and be productive, and that's part of your documented disability, you can ask for accommodations from your employer, just like any other person with a disability would. So if I were blind and I couldn't read my screen, an accommodation I could ask for from my employer is a screen reader. And they cannot tell me, well, if you cannot read the screen, then you cannot work here because that's violating my rights as an individual with a disability. Similarly, with mental health disabilities, if you need some specific accommodations, such as your employer recognizing that sometimes if your symptoms flare up and you have major depressive disorder, you may skip a day of work because you just don't have the energy to get out of bed. Or if you have bipolar disorder and you sometimes go through these manic phases where you're just go, go, go and just cannot focus, and you need some time to just let that pass and to be able to take some time off without it impacting your performance evaluation at work or the way that your manager or your supervisor might perceive you in terms of effectiveness at the workplace. So typically most large companies have either an HR department where you can work with HR on your disabilities. You don't have to disclose your disability to your employer. You just have to work with the HR on it. They might require some documentation. It may come from a psychiatrist. It may come from a psychologist, which documents your disability. And then they'll work with you on identifying what the accommodations are that you need that allow you to do your work in the best way possible while still keeping in mind the impact of your mental health disorder on your functioning. I work a lot with college students who have disabilities, and for that, we'll refer them to the Office of Disability Accommodations. We'll work with them to identify the accommodations and then send them to us as professors so we can provide those to them in the classroom as well.
Well, thank you, Dr. Sharma. That is really good information. Mm-hmm. And I really hope that makes people more comfortable going out and seeking help, like even if it's a college student or someone who's employed, because I know people are always worried about the stigma and the judgment against them. So it really prevents them from going and taking help.
Yes, absolutely. That's what we hope. It's important to, again, realize that if you have a mental health disorder and it impacts your functioning, it's not that you're lazy or you're not motivated or that there's no hope for you. There are proper supports that are available for you. And we just really want to encourage individuals to become more familiar with them and seek those to help them have the quality of life that they would like.
Well, thank you. Thank you, Dr. Sharma. So Nirav, I know I've told you before also, When actually I was planning this webinar, and I was really finding it very challenging to finding a Indian male therapist or someone like a South Asian therapist. So when this happened, I was looking at some statistics and how often South Asian men seek mental health help. And unsurprisingly, I learned that South Asian men are one of the least likely groups to seek mental health care. So what has been your experience regarding men seeking mental health help in our community? Are there any cultural barriers that prevent men from seeking help and going to a therapist?
Yeah, I would say just overall, not just Indian culture, but culture in general, but also in Indian culture, right? It's maybe perceived as weakness, right? You're weak. You can't get over this yourself. You can't tackle this problem. What are other people going to think of you? If you're the, patriarchal society that we kind of, go back to with our roots in some ways, head of the household, if that person's weak, then how's that going to affect the family and such things? I have had quite a few older males do reach out to me, and I've worked with a few. I think a big thing that I do want to touch on is in Indian culture, we think that we look for the answer to why, and we want someone to answer our questions. So at this time, I just want to say in therapy, as your therapist, I can't tell you what to do, right? So a lot of the time I found with a lot of Indian males, especially the older ones, they want to be told what to do. They want me to tell them, are they making the right decision? Ethically, I'm not allowed to give advice. So I just wanted to touch on that because that's always very important. I think that's a big misconception about therapy, and I think that holds people back. And then sometimes when people do come into therapy, they don't get what they want because that's what they were thinking.
Right. Yes, absolutely. So it is even more challenging, like you said, for men to go and get help. Right.
Yeah.
And I suppose it would be even more difficult for the South Asian men.
Yeah.
I think it's just our culture that way.
Yes.
So do you notice any trends in help seeking by generations? For example, between the first generation, the second generation South Asians, and also how about across the generations, like the baby boomers versus millennials versus Gen Z?
Mm-hmm. I definitely do. A lot of second generation will reach out and do not have as much shame or guilt around reaching out and asking for help. First generation, still very difficult to get them to come to the office. And even if they do make an appointment, sometimes they're very anxious about all these things. So they're not educated on a lot of like confidentiality, what is therapy, what's the difference between a psychologist and stuff like that. So there is a big difference across the generations. Yeah, again, you are seeing more baby boomers come to therapy, but yeah, a lot of Gen Z and millennials.
Okay. So, that means it is changing then, right? We can hope that the future generation is going to be better in the mental health terms.
Yeah.
This is something, that I know a lot of us are concerned about. Our local community in the North Dallas area has seen a few devastating cases of suicide. Some reasons that have been cited for this uptick in suicide rate include like stigma associated with seeking mental health help. That is why we are doing this webinar actually. And also easy access to weapons, pandemic-related isolation, challenges in communication with your family and loved ones, especially in the South Asian families. Communication has always been an issue. We do not talk about how we are feeling. That is not something that we convey to others. Very rarely we say it, but we don't actually go out and give the whole picture. So suicide is actually a very extreme step, right? And in most of the cases, it comes as a big shock. Even to the very close family members, they cannot imagine that this thing has happened. So I want to ask Dr. Sharma, what are some signs to watch out for regarding someone's risk for suicide?
Sure, absolutely. Well, typically, when a person is feeling suicidal, they may start isolating themselves. So you may find that they're not engaging in a lot of social contact. They're really maybe leaving themselves barricaded in their room. You may find that they're starting to possibly give away things like, here, you should take this. That's my favorite thing. I want you to keep it. Or really start making a lot of end of life plans. They may even a lot of times start saying things like, life would be better if I wasn't around, or, my life is not worth living. And there tends to be a misconception that if you ask somebody about suicide, it will make them want to commit suicide. And that is proven to not be true. So if you hear somebody saying things like that, it's important to talk to them, to let them know, hey, I've heard you say that you feel like you no longer want to exist, or that you would rather die. I'm worried about you. I want to get you the support. What can I do to help? Can I help you schedule an appointment with a counselor, or can we call the crisis hotline and talk to somebody there together who can help us? People who are suicidal or who die by suicide, typically it isn't a very impulsive reaction. It's something they've thought about for a while and just were not able to get this support that they need. So they found themselves feeling really hopeless. So hopelessness is one of the strongest indicators of a person having a higher likelihood of dying by suicide. If it's okay with you, I'd like to share some resources for suicide right now, because it's important for us as just individuals who live in the community to be familiar with resources. So even if we don't benefit from them, we can share them with someone else who might. So the primary number for the National Suicide Hotline is 1-800-273-TALK. And it's 1-800-273-8255. They have hotline workers available 24 hours a day, 7 days a week. You don't just have to call them if you're feeling suicidal. You can call them if you feel like you're in a crisis and you just really need to talk to somebody who can give you that support until perhaps things stabilize a little bit. For individuals who are possibly more tech savvy, they don't want to call somebody, they would rather text. They can text the word connect to the number 741-741. That's the word connect to 741-741 anytime, 24/7 a day, to again reach out to someone and have them respond back to you via text. If you feel that there's a life-threatening emergency, maybe you're concerned about a family member or a friend who possibly seems to be for some reason ready to die by suicide at that time, or just kind of have that feeling, it's always okay to call 911 and get that support so that they can then call what's called a mobile crisis unit that will come in and do an evaluation and provide that individual with the support that they need right now. There's also a suicide and crisis center in North Texas if people would like to reach out maybe to a local agency. They also have a 24/7 crisis line, and their number is 214-828-1000. That's 214-828-1000. And then there are also some resources available purely online. So a good website to begin with is suicidepreventionlifeline.org. So suicidepreventionlifeline.org is a good website to begin with. If you forget everything that I said and just need to access some resources, they have a listing of many similar resources.
Thank you, Dr. Sharma, for sharing these resources. These are life-saving resources.
They are. And like I said, it's important for all of us to be aware of them, because you never know when this resource might be exactly what you need to help save someone's life, whether it's the life of a loved one or just another community member.
Absolutely. Dr. Mutineni, how can someone as a friend or community member reach out to someone who might be struggling?
I think talking to them helps first, because when someone says, I am sad or I'm overwhelmed, we tend to say, it'll get better. Or, you're having a difficult time, things will change, it'll get better. Or if a child says, I'm sad or depressed, I think most parents would say, what's the reason? You have everything going for you. You have there's no reason for you to be sad or anxious, where we shut down the conversation. I think we need to talk to them and ask what is going on, what makes you think so, whether it is an adult or child. An adult can be stressed due to work, and they may have some underlying depression and anxiety, which could now exacerbate. And then that could be where they are feeling hopeless and worthless and may want to end their life because they think that their family would be doing much better without this person who's depressed and who's not contributing as they think, because in their mind, they're not contributing to the family or society, but they are really contributing, but they're not able to appreciate it. So they may want to do something to end their life. Or a child, well, everything is going well for you. What is the reason to be depressed? Then that shuts down the conversation. So my mom and dad don't understand. So it starts with, most often, it starts with self-harm behavior, where they cut their body to see if that feels better. And then they make plans to end their life. A lot of parents say that, children do searches. So if you see their search history, anything that's concerning about suicide, self-harm, how to die, anything that would make you concerned, you need to have a conversation and take them to a mental health specialist, whether it is a therapist or a psychiatrist, as soon as possible. And if it is over the weekend or something, I would recommend you to go to the ER immediately to see where your child is. If it is an adult, the family should talk to the adult, and if they feel that they're safe, they can wait. If not, take them to the ER. But if you feel that your child or a family member can do something and you're not sure, take them to the ER. And if you're going to keep them at home till the weekday and schedule an appointment, I always tell people to make sure that there is nothing that person can use to end their lives. That means locking away their knives, making sure that someone is with them all the time. They have no access to weapons, no access to medications, and sometimes they may have to, even for children, for adolescents mostly, sometimes even taking away the door or keeping the door open so that the parents can visualize the child anytime, and always be in the living room unless they're sleeping. So those are things. And again, talking to them continuously also is going to be stressful when they're already depressed, anxious, and they're feeling worthless. And we to them, that doesn't going to help. So giving them short intervals, talking, doing something activities. If it's a child, I say, do something as a family because children tend to open up when they're playing games. When they're playing a board game, they may talk about something they're feeling. So those are things they can do to help a child or an adult if they're having suicidal thoughts.
Okay, that is great advice for parents, actually. Yeah, especially in these cases, definitely parents sometimes just feel really helpless. They don't know what to do. Sometimes they just don't know how to respond to a child saying that. I mean, if someone comes home, that your child comes home and says that, oh, I'm feeling depressed. How does the parent address that? What do the parents say? I mean, how to address such a thing from your child? I think
the first thing we have to ask them why they feel, what is going on, what makes them feel that way, and how did they come to this conclusion that they're depressed, and how long they have been feeling this way, and what else they have been experiencing. Because teenagers are very secretive. They're not going to be very open to their parents. So it's very important for them to feel comfortable enough to say, I can talk to my mom or dad, anything. That's the first thing, instead of judging them Because when you say what is wrong, you look fine, you just went to a game and you came and now you're depressed, that's when they feel like you're judging them. A depressed child can still go to school. A depressed child, a suicidal child can still go to school. A good number of times they have stray days. A good number of times they are participating in activities. They're doing a lot of things, but once they are in their room, they may be crying, which you may not be aware. They may be turning on the loud music, and whereas they're crying or they're self-harming, you don't know what exactly is going. And I also tell parents not to blame themselves, because you can't know everything about your child. Just because it's your child doesn't mean you would know 100% every tiny detail of what's going on in your child's life. But it's very important that you make the child feel comfortable, that they can talk to you about what's going on, how they feel that they're not worth it, or they may not tell the parent that they're because they don't want to be a burden to the family, because mom and dad are going through struggling at their work, or they're having a stress, so I don't want to put my stress on them. That's a depressed child's thinking. I'm not worth it, so I don't think mom and dad need this extra stress from me. Or if there was financial issues at home, I don't want to add to their financial burdens by telling them that I need to see a doctor or a therapist. These are some things that I think parents should not bring that to. Parents should be aware that these are the reasons the child may not be bringing to their attention. Oftentimes I see that when a child seeks treatment, and after time, sometimes parents say, "Oh, we are spending a lot on your treatment." That is the worst thing a depressed child has to hear. I mean, a parent can say, because they're already feeling sad, they don't feel great about themselves, and there is this parent telling you, "You are a financial burden to me." So that's one of the things I would advise, never to tell your child that I have to spend a lot of money because you're depressed. You wouldn't say that if your child had asthma or any other physical illness. What if your child fractured a bone or something else happened? You would not tell your child, I had to spend all this money because you have asthma or you broke a bone. Mental health is also equally important. That is something I noticed. South Asian parents, even though they're relatively well off, this comment happens and the child is affected, and sometimes treatment, we take a few good steps and then there are a few back steps because of this whole, of how the statement impacts the child.
That's a great point, and I would just like to add to that it's important to recognize that seeking mental health doesn't always have to be as expensive as we think it is. There are a lot of community resources that are available that are either state funded or federally funded that can provide your child or your adolescent or even you as an adult the mental health services that you need at either no cost or significantly reduced cost. So looking for those resources, becoming familiar with them is a great first step if you feel that cost or that finances will be a barrier in continuing treatment for yourself or your child.
Yeah, great information. Thank you, Dr. Sharma. And thank you, Ms. Neni, for giving all those pointers to the parents, because they really do not know everything that they need to say, and they should not be saying to the child. This is like a dilemma for them, right?
Yeah.
So, Neera, do you have anything to add to this?
No, I mean, I just, encouraging them to, like everyone else on the panel was saying, just encouraging them to express, the feelings and emotions, and letting them know it's okay that, these feelings and emotions are okay. It's okay to have that. That doesn't mean that, there's something quote unquote wrong with you, right? Just having that just kind, safe conversation coming from a place of trying to understand more rather than trying to just immediately solve the problem. A lot of parents will come in and say, my child is depressed. I need you to fix it, right? And that's expected in our community too, right? They're coming to an expert. They're going to say, oh, this expert is going to fix my child, when it's more than just that. So it's just using a lot of empathy, approaching with that just understanding.
Correct.
Yeah.
That is true.
And I would like to add one more thing to this. One of the things I find is a lot of times in our community, a lower emotional vocabulary. So we may be familiar with emotions such as feeling happy, sad, mad, glad, but maybe when your child is saying they're feeling depressed, there might also be some more emotions behind it. Maybe they're actually feeling disappointed. Maybe they're feeling frustrated. Maybe they're feeling scared or worried about something. So as parents, it's important for us to build that emotional vocabulary so we can also train our children to be better able to express what they're feeling instead of giving us, this one big snowball of an emotion such as depression, even though there are actually a lot of underlying emotions there that are more at play.
Very true. Yeah. Great points. Yes. Thank you, Dr. Sharma, and thank you, Nirav. Let's talk about what has been happening in this world recently. So most of us know that we would know someone or the other when we are Indians or Americans or whichever country we come from, that someone has died of COVID especially during this deadly surge of pandemic in India. Many of us lost family members and friends or someone we just know back home, maybe a relative, someone. I personally have lost 2 cousin brothers to this condition, and it has been devastating for the family. So also like our plans to go visit back home, see our loved ones or see our family, everything has been disrupted due to the lockdown or the safety concerns. And most importantly, we could not even be there for our loved ones when they were going through all this. When someone was really sick, when we knew that that person is really unwell, we could not be there for them. And that eventually, if that person has passed away, we still cannot go and we cannot be with them. We cannot even be there for each other. We cannot hug each other. We cannot be there and even say a word, like be face to face with each other. And we are just alone in a way. We are isolated, and the families are not able to grieve together, which is itself is very traumatic. So, Nirav, I want to ask you, do you have some advice or resources for those who might be navigating loss and grief during this difficult time?
Yeah, there are definitely grief groups that you can look up online, just Googling grief groups. There is Journey of Hope, which is for children who've lost someone. I'm guessing that a lot of these groups do not meet in person right now, so they're online.
Mm-hmm. Okay, thank you. Yeah, thank you, Nirav. Dr. Sharma, do you want to add something? Do you have any resources for that?
Well, I would actually just like to share some information about just the process of grief. Like you said, Sushmaji, many of us are really grieving right now. We've lost loved ones and have found ourselves not being able to be close to them during that grief process. When we look at people who are going through grief, they typically tend to go through different stages. The very first stage of that is denial, where there might be a belief that it's okay, it won't be so bad, things will get better, don't worry, don't pay this much attention to it. But then past that denial, when people find that things are being impacted, such as family members whose lives are being lost, there tends to be a sense of anger. And we saw this a lot in India in the past months, where people were so angered by their family members not getting the right support that they were lashing out at doctors or other healthcare providers who also couldn't do anything about it. But that sense of anger where people are like, how could this happen? How could XYZ entity let this happen to whether it's the nation situation, or whether it's our loved ones. And then after that tends to come a sense of almost like bargaining for things. So this is when people might start, if they're religious, they may start praying a lot and saying, God, please, if you can make sure that my family members are okay, I will do this for you. I will do, whether it's puja or kirtan or whatever every day, if you can just make sure my family members are safe through this. And it's when people find that perhaps that is also not working, then there tends to be a severe sense of depression, because by this point you've realized that this is happening, it's impacted your life, the life of your loved ones, and people tend to really feel very down about themselves, about their faith in humanity, or their belief about things being okay eventually. And a person typically has to go through these different stages. They may not always stay in the same stage for too long, but it's a process, and they have to go through this process before they can find themselves reaching a level of acceptance and recognizing that, unfortunately, the thing that they were most worried about losing a loved one has happened, and that life has to move on past that. So many of us are finding ourselves in those different stages of grief right now and just working our way through that. So mental health support is extremely valuable during this time to just help a person normalize those emotions and recognize it's okay to feel, whether it's angry or sad or just so frustrated with the situation that we've all encountered, and walk through that instead of feeling guilty about it, or just not being able to understand where all of these emotions are coming from if they're naturally a very calm person who's able to self-regulate their emotions.
Yeah. Dr. Sharma. Yeah, Dr. Michanani?
Yeah. With children, I would like to say that if a child lost their grandparent in the epidemic, in this pandemic, and it's okay for the child, for the parent to say that they are sad as well that they lost their parent, than try to repress their emotions and say everything is fine and dandy. Yes, I lost my dad, or I lost my mom. I'm sad, and I'm sad as well, because if the child is attached to the grandparent and the child is feeling sad, we have to. It's okay for the child to express the emotion, and for us to share our thoughts. We're not talking about morbid thoughts, but thoughts like, yes, I'm sad as well. I have days where I feel like crying too, but death is also part of life. This has come as a shock, but this is part of life. There are times where this is the time where we were helpless, but we are safe, and making the child feel safe that they can express their emotions, but at the same time that feel that they are safe right now. I think that helps immensely with the grieving process. As Dr. Sharma said, the 5 stages of grieving, yes, we all go through it. Children go through a different way, but the support we as a parent can provide them helps them in that grieving process. And if they're still struggling after that, as Nirav said, yes, they can go to grief. There are a lot of grief groups for children in the Metroplex, and I think both Cook's Hospital and Children's Hospital have grief groups in their area, and a few other offices, counseling group offices, offer these group therapy sessions in communities. So those are things they can reach out to if they're still struggling after a few months.
Mm-hmm. Yes. And I think it's also important, it's a great point you made, Dr. McNanny, it's also important to recognize that parents are typically modeling behaviors for their children. So just like I was saying earlier, children learn a lot of ways of coping, of expressing emotion from their parents. So if parents can manage their emotions and say, it's okay to be sad, we just lost somebody that was dear to us, but also teach the child how to manage that emotion instead of not talking about it, not discussing it, kind of sweeping it under the rug. That goes a very long way developmentally in teaching the child how to manage those different emotions as they become an adult. A great place to start for resources is the Psychology Today website. Nirav and Dr. McNanny shared some great resources in our community. If you just go to the Psychology Today website, you can narrow down the search, look for mental health professionals who specialize and things like grief and loss. And then those are the individuals that you can reach out to schedule appointments.
Mm-hmm. Yeah, thank you for those resources. Yes, I agree that psychology today really has a lot of resources for mental health help. And I do think that, yes, people should reach out. I mean, they can do their research, they can call them, they can see with whom they are more comfortable, and then reach out and get the help that they need, whether it's for the child or for themselves. Thank you. I want to stay on this topic about children, and I want to ask Dr. Muthuneni. Many children actually stayed home for the virtual school last year, and they're still at home. This situation actually is not just difficult for the child, but for the parents as well, because they have to homeschool them. Mm-hmm. Even if they have their own work, they still have to monitor the child doing
yeah.
It's not been an easy time, actually. How could this period would have affected their development? I'm talking about the children. And how can they best reintegrate for in-person schooling whenever it happens, whether it's this fall or whenever that happens?
I think the first thing that is affected with children is their social skills, especially elementary age children. A lot of, they lose their social skills because they're no longer socializing with anyone. And even families don't socialize as much as you would socialize couple of years ago. I can't even say a year ago, because a year ago, last year, this time we were in beginning of the pandemic. So yeah, a couple of years ago. So the social skills are the first ones that have been impacted with a lot of these kids. So reintegration, in the sense, summer is a good time for them to first socialize with family, friends. If everyone is vaccinated, you can start with socializing with your family and friends, and be mindful that your child has not used these social skills for more than a year. And these are the skills. This is the time they learn those skills, and they have lost, 1 year they haven't used it, and they're using that these social skills, and sometimes they may be not so outgoing. If your child was very outgoing before, or too excited that you, as a parent, you would be embarrassed to say your child is the loud one there, because they're so excited of seeing all these children after a year. Being kind to them and telling them it's okay, we'll be doing this again, or let's try this again, because if we do it again, maybe they'll be more comfortable and they can socialize. That's how you start. And I think most of the teachers in schools are aware of this 1 year pandemic effect. And hopefully most teachers will have that empathy and realize the first month is going to be a little rough than usual for the children. Kids who had underlying depression, they have been more depressed because they have not been able to use their usual coping skills, in a sense, whether it was painting or talking to friends, different other coping mechanisms they were using. Some of them were not able to access that. The kids who thrived well during this time were the ones who had social anxiety. Mm-hmm. The ones who were very awkward and were often anxious in the school setting, who didn't like talking to people, who didn't like being in a gathering. This was they thrived, because for them, they didn't have to interact with anyone, and they can finish their school. They didn't have to interact with any extended family or friends. This is the only group that thrived. But the anxious kids were more anxious because they didn't know what the pandemic would lead to. And if they had 100 questions before, now they have 1,000 questions because of the pandemic. Mm-hmm. So that was worse. And the kids who had ADHD, it was a struggle for the parents, because they struggle with paying attention. And then you put them in a virtual class where there is no structure as such. There is a class, but it's not as structured as a regular class. So they couldn't finish their schoolwork. Parents had to help them in the evenings. Not every parent can help them in the evenings. Those are the ones, they also suffered a lot because they are not they didn't learn how much they would have learned if they were in a regular class. Kids have suffered, but I think slow acclimatization, which is taking them to parks, meeting family and friends, is the first step in making sure that they succeed in school.
Mm-hmm. Yeah, thank you. Yeah, Dr. Mohini. Yes, that is true, because this has been a very challenging time for kids and the parents, and even the work. I mean, how do you have one laptop or one computer for your work, and then at the side you have your 2 kids or 3 kids, also doing their schoolwork. So it is challenging. Nirav, I want to ask you the same question. I mean, did you experience someone saying that to you, that they are having a tough time, like during this pandemic?
Yeah, because we, as humans, we are social creatures. So that social aspect was taken away from us, right? Time was taken away from us. Uncertainty, fear, panic. So there was definitely a lot of people who did have that. Seeing a lot of virtual clients. They even struggled in virtual sessions, right? And then as soon as they could come into office, they were excited to come into office just to have some sort of human contact. I think. It's definitely taking a huge toll on all of us, because it's unprecedented times with things that, like like everyone else was saying, our go-to coping skills were taken away. We were forced into forced isolation in a way, in which as humans, we're social creatures by nature.
True. Yeah, thank you. Yes, Nirav. That is very true. I want to ask Dr. Sharma one question. I know we all, our kids, and we have pets, and we really love them. And I have seen that, the loss of a pet can really have a toll on the mental health.
Mm-hmm. Absolutely. It does, because pets become part of our family. Being someone who's gone through the loss of a pet myself, I can say that loss is tremendous. It's someone who's a constant companion, who's there with you, who you provide care for, and they provide a lot of times emotional support to you to help leaves a void in the person's life. So while, it's very sometimes insensitive to just say, oh, it's just a pet, it's just an animal. Why are you so sad about it? I think it's important to recognize that for people who've had pets, it's not just a pet, it's a family member. And so their loss impacts them just the way the loss of a family member would. There are actually some therapists, some counselors who specialize in the loss of a pet because they understand that impacts us in just so many ways. So instead of minimizing that, it's important to also address that as a challenge that a loss that a person is experiencing in not having that pet around them at all times.
Yes. Yeah, very true. I mean, I also experienced that, and I think that really has an mental health effect on the children, because they play with them all the time. So
they do, absolutely. I also wanted to add something to the conversation earlier about us transitioning back to being in person, whether it's school or work. It's important to keep in mind that this is going to look different than anything, because it's a transition, right? So we remember when pre-pandemic, our lives were a certain way, and then the pandemic happened. We talked about the new normal, right? The new normal became being at home, not interacting with people, being fairly isolated, and we learned to adapt to that a little bit. Well, now we're going towards another transition of the new normal, right? Where all of the things that we've done for the past year and a half now maybe are no longer at play, and we have to relearn how to integrate ourselves into society, to have conversations. I mean, for many months, the only conversations I had was with my pet in person, and the others were over the phone or through Zoom when I was talking to my colleagues or family members. And so to learn to go instead of just having singular conversations with people on Zoom, we could be having multiple conversations with people, the person to your left, the person to your right in a meeting, the person in front of you. you. So for some, it can lead to a bit of a sensory overload as well. So it's important to keep in mind that we may struggle a little bit with this transition. That's to be expected. Many of us are going into this with the expectation that we're going to thrive now that we're back in the pre-COVID stage in many ways. However, what a lot of us are finding is that instead of thriving, we're actually still languishing. We're feeling a bit anxious about it, feeling a bit reluctant to engage, because for a year and a half now, we've learned to interact very differently than the way that we will now be expected to do again as we start integrating to in-person services.
Thank you, Dr. Sharma. Yes, absolutely. Yeah, and thank you so much to all of you, for all these insights into mental health help. I really appreciate that. And I'm sure the audience are actually, they have benefited from all this knowledge that you had to share with them. I do have a question from one of the audience. It's they have addressed it to Dr. Mutineni. It says that what are the early signs, what to watch out for, and how not to show emotions. I know we touched upon this during the discussion, but if you could please let them know.
What to watch out for with respect to what?
Like if they come to you with saying that they have some early, like if you see that they have some early signs of mental disorders. So it's like how not to show your emotions to that how to react to that.
Okay, so what I understand is so a parent is asking how to know that whether my child needs mental health help and how do I support it?
Mm-hmm. Right.
Is that something they're maybe asking?
Yeah, it's from the parent's point of view. So
if one of the things is if your child is struggling in school, or if your child is struggling at home, I'm not saying everyone, but most of parents have at least 2 children, or they've seen their nieces or nephews. So if you see your child's behavior has changed recently, or there has been a gradual change in your behavior where your child seems to keeping to themselves, you've noticed a change in how they function, whether it's with their sleep, with their appetite, with their energy levels, those are early symptoms of depression. Okay, it's okay to take them to a doctor. A lot of pediatricians also do screening at this time for depression at various ages when they have their annual visits. Those are early signs of depression. For ADHD, the first thing you would notice is in young children is they're making a lot of simple mistakes. They can't seem to sit still and can't pay attention. We're not talking about a 3-year-old who's always jumping. A first grader or second grader, you give them a simple instruction and they always seem to be like lost. Like they are always in their world and not with us. It's not that they can't do it. It's just they can't pay it. They will... their attention is not there with you. And instead of being firm with them, talking to them, looking them in the eye, giving them one instruction and see if they can do it. Or if you see in their work, they're capable of doing their work, but they make simple mistakes. Those are all symptoms of ADHD. And anxious kids tend to ask a lot of questions. For instance, the pandemic. Mommy, what is going to happen to us? Will the virus come through come through the door? If you open the door, can I open the door? Can I open the window? They will have so many questions. You would be like, oh my, this child has too many questions for me. Where you will notice that the theme is more they're worried. Those are the signs which tell you my child may be having a little more anxious, more anxiety tendencies. So those are things that will give you a clue if you're noticing, if you think that your child is anxious, depressed, or has ADHD, the most common things.
Right. Thank you.
I would like to add something to that and offer a tip. Friends, maybe when your child comes to you and expresses feeling a certain way, try to ask them what are called more open-ended questions. So instead of asking them, why are you feeling this way? Asking them, tell me more about what you're feeling. How often have you been feeling this? What are the different times when you feel these sort of symptoms? Or just allowing them to have a conversation instead of asking a why question, because a lot of times they may not know why they're feeling a certain way. And so it's important to not get stuck in the why, but instead to try to have an open conversation about it, to let your child know, I'm glad you shared this with me. I really love you, and this doesn't change that. Let's work together on getting that support for you. Maybe we can make an appointment with a doctor and go talk to the doctor together, or go talk to a therapist together, so we can help you feel better or feel the way that you would like to. I think it's those sorts of conversations that typically children find really comfortable, which also encourage them then to share or disclose the way that they're feeling to their parents.
Yeah, I think that's a good point. Instead of the why, because most of the mental health issues will not have a why. When I gave the example of the pandemic, it was just an example. That child may be very concerned even about their grades. If I get a 99, what would happen? Will the world fall apart, or will his or her world fall apart? Is my dad going to be angry? Is what's going to happen? What are the consequences? It's a simple thing, but that's the theme I was talking about, not just about the pandemic. That's there for everything which you wouldn't be worried about. What if I stub my toe? Will I be able to walk ever? Is the bone broken? Do I have to go to the ER? Small thing, but again, when it's a 2 or 3 year old, in toddler age, that's normal because they're still learning. But if they are in elementary school and, you think they're not able to cope and they're struggling, that means there is some underlying anxiety, and the pandemic has made it worse. So we have to ask them more open-ended questions and allow them to express their thoughts then. Why do you need to have this, or why do you have this? There is no reason for a why. It's like you never ask a child, why do you have asthma? You never ask a child, why do you have diabetes? I'm talking about the juvenile diabetes. Or, we never ask a child about if they have, I don't want to say cancer, but if a child has cancer, you never say, why do you have it? When the 99% of children don't have it, or things like that, or things of that nature. Or so we don't have, there's nothing the child did or you did for the child to be in this situation most of the times. So there's no point in asking. Trying to see the cause, but let's see how we can address it. If there is some trigger, there could be a trigger, but not something that would be the cause.
Yeah. Yes. Thank you. Yeah. Thank you, Dr. Sharma. Thank you, Mituneni. This is really great advice. This is what we really wanted to accomplish with this webinar, that the parents and the children understand about the mental health issues. And once again, I want to thank Dr. Jyotsna Mituneni, Dr. Rachita Sharma, Mr. Nirav Shah for taking time off their busy schedules and sharing your wisdom with us. From this webinar, I see that we have so much to take home from this. There is so much to learn from what all you have mentioned over here. And one thing that is really important that I think is communication between the family members. That is what really opens up the doors. So I would say that everyone needs to talk to their children. Parents, if they're a child, talk to your parents, grandparents, your siblings, your extended family members, friends, co-workers, neighbors, and always stay in touch. Do not lose touch. And most importantly, if you know someone that has gone through a rough patch in their life, then it is even more important to let them know that they are not alone and they can seek help. And I would say that please make sure they know that they have a friend, they have a person they can lean on. So thank you, everyone. Thank you for everyone who has been part of this webinar. It has been so much of information to take, and I know I'm still processing it, and I know everybody else is processing it too. And before I end this webinar, I would like for all of us to raise our right hand and take this pledge. Please take this pledge with me. I promise to change my behavior to support everyone affected by mental health conditions. I will listen more and judge less. I will not use harmful words that prevent people from seeking help. I will be an ally to friends, family, and co-workers. I pledge to be more aware and create awareness about mental health and be stigma-free. Thank you so much. Stay safe, stay healthy, and stay happy. And please do not give your past to define your future. Thank you, everyone.
For attending today. Thanks to our panelists, Dr. Jyotsna Mutaneni, Mr. Nirav Shah, Dr. Rachita Sharma, who delivered great information on a very sensitive topic of mental health. A lot of great information is shared on this sensitive topic, ranging from how to identify mental health issues, how to seek counseling help, and how to help in removing the stigma of not talking about it in our community. And more importantly, how to help anyone who is going through this. Very, very useful information shared, and I'm sure it will help the community a lot. I appreciate the time you all spare today away from your busy schedules over the weekend, away from your family for the community. Very much appreciated, and thank you to our moderator Susma Malhotra ji, who did a great job in moderating this very important topic for our community. It's more important than ever now during this pandemic, and we would like to thank all our sponsors who stood by the institution of IANT and believed in what we do for the community by supporting us and continue to support in these challenging times. We would like to thank our various sponsors, corporate sponsors, Heritage Land Bank, Discount Power, New York Life Insurance Company, University of Dallas, our gold sponsors, Paul and Geeta Pandyan, silver sponsors, Sunil Mani, CPA and PC, and Core Enterprises Inc., Southwest Colon and Rectal Clinic, our supporting sponsors, Aluwalia Law Office PC, SkyPass Travel, Radio Karama, Roar for Change, North Texas of Food Bank, and Clean Air Living. Today's event is live streamed by our streaming partner Mahamaza. Without support of whole team at Mahamaza, we would not have been able to bring this webinar to you. I want to request all community members through this webinar to support India during this COVID-19 pandemic. India Association of North Texas is targeting to raise $100,000 to send required help back to India in terms of medical supplies or helping the affected families through US-India Chamber of Commerce and other non-profit organizations working on the ground in India. No donation is small, and please open your wallets to send the much required help to India. To donate, please go to www.iant.org and look for donate button just above the COVID relief flyer. So once again, a big thank you to all panelists for today's webinar, IANT board, trustees, and a special thanks to our sponsors. Without these sponsors, our activities would not have been possible. Thank you everyone for attending, and this adjourns today's webinar. See you next time soon on another important topic. Thank you.
Thank you.